Hi, my name is Shaylee Bell. Today I will be performing a NG tube insertion. So I would knock, I would identify myself, I would provide for privacy and perform hand hygiene. I would identify my patient using two patient identifiers like name and date of birth. I would check the medical order, make sure that the order was correct, and I would explain the procedure to the patient. I would ask the patient if they had any allergies, or if they've had any facial trauma, nose surgery, throat surgery, anything that could compromise an NG tube. I would be doing all general principles and safety practices today. I'll put my gloves on. I'll make sure that my patient is at a comfortable working height and that they are in a high Feller's position. I'll pull their blankets down. Place the chucks over them. And I will measure from the tip of the nostril, tip of the earlobe, and then down to the xiphoid process. And then get my lube, I'd place it 2 to 4 inches. And then before I would place it, I would ask my patient if they had a preference which nostril it went in, and then I would have them hold one, breathe in, hold the other, and breathe in. Had them lean with their head against the pillow, and then I would start to insert it. When I felt resistance, I would have them lean their head forward, chin to chest. I would offer them water. With each sip and swallow, I would push the tube further. On a mannequin, it's a little difficult to go very far. I would tape it. If they, when I was doing this, if they did start coughing or couldn't breathe or couldn't talk to me, then I would stop, remove it, because the tube could be in the lung. So I got that. I would, when I got the tube placed, I would get an x-ray to ensure that the tube was correctly in the right position. I will check the pH. I'll make sure that this is above the stomach. Check the pH. Yep. I would then measure from the tube from the nostril out, just to ensure any movement or anything that could happen. I would do the measurements, I could document that. I would see if my patient could turn their head side to side. If they were having any throat discomfort, then I would offer them any throat lozenges or throat numbing spray. Tape it. There's many different ways you can tape it. This is just the way. Make sure the tube is not too tightly, because it could make the patient gag. Again, I'd make sure my patient is comfortable, that everything is okay. If they're comfortable, I'd remove the chucks. Put the blanket back up. Again, I would not hook it up to suction until I got the x-ray, just to ensure placement. I would remove my gloves. I would perform hand hygiene. I would offer oral care every 2 to 4 hours if the patient would like it, needed it, or anything like that. I would report, and I would evaluate that everything was okay.